Welcome to Focus on Health, a series of educational programs highlighting current health issues sponsored by the School of Nursing at Salisbury University. I'm Dr. Mary DiBartolo, Professor of Nursing at Salisbury University and host of the program. We are here today at MAC Incorporated in Salisbury, and I welcome Robby Chin to the program.
Thanks for having me.
The title of this program is Importance of Exercise in Movement Disorders. And Robby, you are certainly qualified to talk about just exercise in general, as well as you have some specific programs for Parkinson's disease patients.
Indeed, yeah.
So let me let our audience know your various qualifications.
Sure.
You are a certified personal trainer. You are also a senior strength and conditioning specialist, among other things. And you have a lot to talk about today and equipment to show us.
Gotcha. Yeah, we do have a lot to cover.
So before we get to that, though, let's just talk about, in general, the benefits of exercise.
Sure. So in general, I have a focus on geriatrics, training with mature populations and special populations, though I also train young athletes and folks as well. But in general, exercise, keeping your body moving, staying mobile, it's the one thing that we can do for our bodies that doesn't have any ill side effects. It's always important just so we can continue to do our activities of daily life, whether we're all training for some sort of performance, whether if it's sports related or you're just, you want to be able to go out and do the things that you want to do, go on vacation, go see your kids, go for a hike, just enjoy life. Do the things that you want to do without feeling constricted by your capabilities. I'm sure we all have some level of pain or something, conditions that we're working through, but that's okay. Getting plugged into the right place and being around the right group of people or knowledgeable trainers is a great place to get started. And most people's physicians anyways are kicking them out the door to go ahead
Right,
and
I think the
exercise.
most thing physicians will first start with is it's good for the heart and the lungs and the blood pressure, those kind of healthful effects.
Yeah, so there is a long laundry list of things that exercise, even it doesn't have to be strenuous exercise, can be helpful for cognitive function. It's good for your heart, good for your respiratory system, conditioning your muscles just to keep your bones strong, keep your joints healthy, your posture. Even though posture just looks nice, it's also functionally that's where your joints work the best. So it's really important. You don't have to have a background in exercise. Don't wait to find a perfect trainer or find a perfect gym to start at. The hardest part is just the first step, and then just go from there.
So we know exercise is good for people of all ages, but today we're going to focus on the importance of exercise in the older adult population first.
Okay.
And of course we know with that age group there can be the osteoporosis you mentioned, where weight resistance is important. There can be arthritis, and exercise can actually help with that, help reduce the pain and stiffness in the joints. And then the other important thing, and this is especially important for people with Parkinson's disease, is the importance of exercise helping with balance and preventing falls.
Absolutely. Especially important doing training, whether it be exercise and strength training or doing some sort of mobility training, or even things like yoga and Tai Chi, things that focus on meditation, mindfulness. Those are all important training aspects for fall prevention, especially for folks that have Parkinson's, but just for anybody in general. That's really important just so that we can maintain the integrity of one's skeletal system, so preventing the osteopenia, porosis. But just with that, being able to condition certain muscle groups, make sure that certain joints are functioning the way they ought to be, that you have the mobility so that if in the event you lose your balance, you can make a corrective step or move to keep yourself on your 2 feet. So.
I know, but also for just seniors in general, because no one wants to fall. And of course, being flexible enough to prevent falls or get yourself up off the floor if a fall should happen. So hopefully we can prevent those major injuries that can occur with falls, fractures and whatnot. Now, we are here at MAC, we know, and you have been here about 5 years now working at this special gym designed for older adults to use.
Yeah.
So I know you want to show us a lot of your equipment that you have
Yeah,
available.
I can show you some of our toys.
Okay.
So all of our equipment that we have here is designed specifically for low impact. That way we can still work on strengthening your muscles, getting those bones a little denser, but also just make sure that we aren't causing any, I guess, excessive compression onto the spine or any, most folks have either had some sort of either cartilage, the lack thereof, or meniscal issues or joint problems. So all the equipment that we have is specifically designed for that. Whether you have issues with your joints or not. You know, we have a anti-gravity machine, we've got stationary bikes, ellipticals, treadmills, new steps, which you would also see at like a cardiac rehab type setting, and various pieces of resistance equipment to focus on conditioning specific target areas of mature populations that tend to atrophy a little quicker than others.
Well, I know you have an elliptical right here.
Yeah,
So why don't you give us a...
So this is one of our few pieces of equipment that we have here at the gym. This one's really easy to get yourself set up on. I don't necessarily trouble folks with like the electronics, but basically it's powered by your like I said, the woman or man power. And this does a great job. Like I said, it's low impact. Works the upper and lower body. And this is actually a really great piece of cardio equipment. After just a couple minutes on here, one will definitely feel their heart rate start to go up a little bit. This is just really nice too. So like for folks that either have a hard time walking for a long period of time, like this is really great for them to condition the same muscle groups, but with a different exercise. Also, it's even less of an impact on their like knees, ankles, hips, and lower back than it is for like walking. This one's really good. I know me and the other trainers like to use it just sporadically. Like folks can come in and just do it for straight time and just maintain a steady pace. Or sometimes what I'll give folks tasks to do is say, all right, let's go for a minute and just give it all you got. Let's break out into a sweat. But like I said, it's a really great one to like work on strengthening the muscles of the legs. It's really easy on the back and the knees, and it really does a great job. Like I said, like kind of getting your heart rate up a little bit too.
And people can go at their own pace though, to slow down as they need to,
Yeah.
and that kind of thing. Okay.
So
So how about we head over to the Recumbent Bike?
sounds good. All right, so this is our Recumbent Bike. This is a great piece of equipment. So just to condition the lower body, it's really, again, super low impact. This is actually a really good piece of equipment for folks that have had either have various kinds of arthritis, if they've had issues with the meniscus in their knees, the cartilage too, so like, or maybe lack thereof even. This way, like I always kind of tell folks, one of my little sayings is circulation is restoration. So this does a really good job just getting legs moving. Also for folks that have had either minor strokes or even Parkinson's, they've shown that getting the legs moving, or like in the arms of the elliptical in a cyclical fashion, if one side is a little more affected or gives trouble than the other, having the other leg or arm move it for forced movement in that repetition really does help out and can be therapeutic in some stances too. So
this is strictly lower body then, and you can adjust the level, I see?
yeah, so you can adjust the amount of resistance that you want to use. So if you come in and your knees are really bothering you, the trainers would probably have the resistance low and just let you move and get circulation into those joints. Or if you want to work on conditioning the legs and actually building up some muscular strength and endurance, we can always increase the resistance. Some of our equipment have these metal slabs on there, so you can even check your heart rate. So either if you want to just monitor your heart rate, especially if you're on like beta blockers or you're coming out of cardiac rehab, or just in general, it's good to see like, right. Oh, I've gone 1:30 and my heart rate's up at 90, and hopefully next week we can be at 1:30 and have our heart rate a little bit lower. So right. It shows that we're making some progress. So there are some of these electronics that help us gauge our progress, which is really helpful.
It's all good for motivation, I imagine.
Yeah. So.
All right, how about we head over to the free weight area?
Cool, sounds good.
So Robby, show us what you have here in the free weights section.
Sure, so here we've got a bunch of our dumbbells, but one thing that we like to utilize a lot here, especially our trainers, is our various resistance bands and TheraBands. Both are really important. I think everybody knows that resistance training is important, but some folks think, oh shoot, I don't like lifting heavy weights, or I don't want to strain, and that's okay. You don't have to. We don't all have a goal of bench pressing like 400 pounds or anything. Our main goal is to like keep our bodies going, and just as the MAC Center stands for, maintaining active citizens. A lot of the things that we can do with our dumbbells and resistance bands can actually be therapeutic and preventative to keep us going too.
Let's see, some here are 3 pounds. They go all the way up to 20 pounds.
Yeah, so we've got weights that range from even just like 1 pound all the way up to 35 pounds. And then we even have a cable machine so we can go heavier depending on what we're targeting, what we want to develop, and how we want to develop it. Everybody has different training goals. And so the important thing is that you're able to either talk with somebody, a trainer. Most fitness facilities, they encourage their trainers to like be open and talk to folks, or if their members have a question, they're there to help. So put them to use, put us to work.
Can you show us an exercise or two that you might show older adults?
Sure.
Easy to do with
one thing
even
that
a lighter dumbbell, I guess.
One thing that we really like to train is the rotator cuff muscle group. So that's basically like the muscles on the back of your shoulder and on your shoulder blade. It's really important, just one, for your posture, but two, it's just for like, getting your shoulders aligned in proper alignment for optimal function. So things that you can do, it's really easy to do at home. Shoot, if you were to take one thing away from this, it would probably be this exercise right here. So keeping your elbows tucked. Tell folks, pretend like you've got a $100 bill underneath each armpit. Keep them tight. Have your forearms right about elbow height. The palms can be up, and just pull the hands back. That's a really great one. If you're feeling it work across the upper back, that's really good. You don't need dumbbells to do it. You can do it with just your arms and work on squeezing your upper back.
Could you use a resistance band?
Yeah, the TheraBands actually. So using bands are really, really great, especially for mature populations, because it has a training effect into the ligaments and tendons more so than just the soft tissues of the muscles. So as our muscles get stronger, we want to make sure all that connective tissue is conditioned as well. So same thing, just keeping elbows tucked and pulling straight apart. This is great. Doing, we say like sets of 15 or more is fine. Even if you've got, say like this is our gait belt that we use around people, but even just like a belt is great. If you have pain in the shoulder, you can even just hold your hands and then pull the strap apart and just pull and hold for like 3 to 5 seconds. That's called an isometric. That's really important for, again, training the muscles, but just holding it, you don't actually get the inflammation response. Mm-hmm. So folks that have had either recent tears or if they have arthritis, managing inflammation is really important. So we do a lot of work, like I said, just postural work, and just maintaining joint alignment, posture, things like that.
And of course, these are all relatively inexpensive at the local store. If by chance you can't get to MAC, you can just keep some of these things at home, the bands or whatnot, and just do. I mean, I assume you do triceps curls and various other exercises with the weights and the bands.
We've been fortunate enough, like we don't need a ton of equipment, as nice as it is, and we would utilize all that we have. We can pretty much train every major muscle of the body with the equipment that we've got. Just maybe like right in front of us is awesome.
I know you wanted to show us this piece of equipment here.
Yeah, so here at MAC we've got a cable machine. We use this just because instead of having a bunch of equipment that's kind of difficult to use and set up and is confusing for folks, this way we can train virtually every muscle group with just an adjustment, and we can change the amount of resistance that we have, and we've got all sorts of attachments that we can use too. So whether if I want to train train the shoulders, hit your rotator cuffs a little differently, train your hamstrings, keep your knees healthy. We can do all of that. A lot of the stuff that we do, you know, some folks have a hard time just standing for a while. We can do it seated. I've had folks like laying on the ground, either on their bellies or on their back. It's a really good piece of equipment. We show a lot of our members how to use it, and with particular exercises that are appropriate and good for them to do too.
Maybe show us one or two.
Sure.
If you don't mind.
So one thing that we're pretty heavy on here is all varieties of pulling motion for the upper body. So for example, like just getting a straight horizontal row. We can adjust this, though this particular exercise would be good on virtually any level. We'd adjust the amount of resistance that we want for the individual, and depending on how many repetitions we want to do. And we just take a couple steps back, root yourself into the floor, and then we always tell folks, if you want good posture, you exercise everything in good posture. That just also happens to be the proper alignment. And then we'll just hit a pull, so we'll go right to the midsection, and the important part is to keep the shoulders back and get a nice little squeeze across the shoulder blades and upper back. Again, what that hits are those stabilizing muscles that help maintain your posture. So posture is really important, like I said, for joint function, your balance, so on and so forth. But there's a lot of lower body exercise that we do in here. Here at MAC, we see a lot of folks that have had problems with their knees, whether it just be, you know, minor arthritis, total knee replacements, meniscal issues, even folks that are bone on bone. It's still okay to have purpose-driven movement and condition those trouble areas.
Now, can you also design a program for people that may need to lose a little weight?
Absolutely.
That would be a different approach, I imagine.
Yeah. So we're pretty well versed with either folks who just want to maintain what they've got, or if they want to shed a few holiday pounds, like we can do that too. You know, we've seen a lot of different joint dysfunction issues. So whether you've had you know, rotator cuff tear, or if you have arthritis, or you've had some sort of like spinal issues or lower back problems,
You've got
we
it
feel
all
pretty
here.
good.
It looks
Yeah,
like.
and we know like we've got a good. I refer to it as like a conjugate care network. So if there's something that we don't know, we have people that we can ask questions to. Like we've built up really great relationships with some of the physical therapy clinics in the area, and a lot of times too, like we've gotten folks out of physical therapy kind of sooner than anticipated, because we've worked with their physical therapists and did like a little 1-2 punch between physical therapy training sessions and kind of private training sessions here. Or even if you're the type of person who doesn't want a personal trainer, or maybe can't afford a personal trainer, we'd be happy to get you set up on a workout program that would be good for you.
I know there's one more piece of equipment you want to show us.
Oh yeah.
So let's walk over there.
Sounds good.
So Robby, this is called Alter G. Tell us about this.
Yeah, so I actually feel very fortunate that we have this at the MAC Center. So this is our anti-gravity treadmill. I believe we're the only place on the Eastern Shore, besides a physical therapy, like more of like a clinical setting, that has one of these. So what this is capable of doing is unweighting a person. So we can take up to 80% of someone's body weight, or perceived body weight, off of their frame. It was actually engineered by folks at NASA. So like when their astronauts would come back from space and they were detrained and they lost bone density, this was a way where they could progressively build up their legs and bone density. Transition them, get their land legs back.
Nice.
So this is has been a really helpful tool for us to use in cases like if folks have had either problems with their feet or ankles, knee issues of all different kinds, hip problems, even things just like arthritis to total hip replacements. We've even had folks that have had spinal fusions and chronic lower back problems use this. Even to the extent of like, we use this for like balance training, so not just like walking or running. And we've even had like triathletes come and use this and just work on their endurance without, like I said, the that compression and jarring on their joints.
Well, show us how it works.
Sure, sounds good. So it's got all different sizes of these neoprene pants. They slide right over whatever clothes you've got on. What this helps us do is it helps the machine form an airtight seal. So we lower the carriage down, and myself, or the other trainers are always here to help, so we'll help get you in. We'll step into the bag or the bubble. We raise the carriage up to about hip height, and then with the pants, that allows us to get zipped into the bag, which then will form an airtight seal. And from there, we're able to take specific percentages of one's body weight off of their frame. So this is really helpful for folks that want to build up either their muscular endurance, if walking any periods of time is kind of painful for them. This is really good for folks that are a little bit more of like a fall risk. This is also a really helpful tool because it's essentially like a fall-proof environment. So like we would just hit start. That sound is the motor. It's pushing air into the bag, and so it'll inflate twice, and it's basically just calibrating how much air that your body displaces. So it's like if you sat in a bathtub and then saw the water level rise, and if we knew your weight and how much water was in the bathtub, we could calculate your body mass. So that's what it's doing right now. It should inflate one more time, and then from there, I can adjust the amount of body weight that I'm feeling.
So it's basically a treadmill with this special feature to reduce.
That's precisely, yeah. And some professional, and I think even some colleges, some professional athletic organizations have these as like a rehab tool for them too. I think Kobe Bryant did his post-op recovery on one of these. So it's reading that I'm feeling 100% of my body weight. I'll lower myself down to like 45% of my body weight, and basically it just kind of helps like lift you up a little bit. It's got cameras so that the individual can see their legs as they walk, so we can analyze their gait in real time. So for folks that have either like knee issues or something, or whether if it's like an orthopedic issue or if it's more of like a neurodegenerative disorder, like this way they can see themselves and we can focus on saying, hey, instead of shuffling your feet, we really need your right foot to work on picking it up. They can actually see their right foot in real time and watch themselves lift it up. And then so we can actually make adjustments on the fly, and they can see what we're seeing to make the adjustments in real time, which is really cool. And then besides just walking, we've also used it for like working on one's balance. So going back to the fall prevention thing, part of it's just practice. Other part of it is like building the strength. In here we can do both, and basically keep you in like a fall-proof environment. You can't go anywhere, which is really cool. So, but yeah, this is our Ultra G, our anti-gravity treadmill.
Very nice, very impressive. So we're back where we started, Robbie, at the Richard A. Henson Wellness Center here at MAC. And I know you just spent some time showing us a lot of your equipment that's available for senior citizens or older adults age 50 and up,
50
for
and
a
older.
membership fee. Tell us a little bit about that.
Yeah, so our gym structure is basically it's month by month. You can pay more than 1 month at a time, but there's no activation fee, no cancellation fee. Kind of it is what it is. If you can't come 1 month, that's okay. We just hope you come back the next month and we can pick up where we left off.
And what is that rate for the monthly rate?
So we've got a couple different memberships, but basically we're looking at $35 a month. When folks join, we also have our trainers give them 2 free 30-minute personal training sessions. We can do a fitness assessment. We can just show you how to use any piece of equipment you think you might be interested in using. That way we just get you acquainted, just get you comfortable, and then make sure let you know like you're a welcomed member of the gym family.
And there's always someone here that can help you with the equipment.
Yeah.
'Cause sometimes it can look daunting.
Right. Oh yeah. Yeah.
Even younger people, you know, some of the equipment,
Yeah.
and making sure you're doing it properly and so forth.
And our trainers are great. Like even though they may be working with the client, if you have a question for them, we're here to help. We're here for you.
So I know the other big piece we wanted to talk about today is that you have a special program for people that have Parkinson's disease.
Yeah.
Tell us about that.
Okay, so that's our Parkinson's Wellness Recovery Program. So we call it PWR for Power. Basically, it's an evidence-based program. They put a lot of research into it. Some folks may have heard of the LSVT BIG protocol. So Becky Farley, the developer of that program, kind of put that program through the next evolution and tailored it more so to meet people where they are in their functional abilities. So with that program, we do a group exercise class 2 days a week. It's on Tuesdays and Thursdays from 11 to 12. It's a really great workout, but even more so, it's such a great opportunity for folks, caregivers alike, and patients with Parkinson's to get together, have like a bit of support, camaraderie. It is extremely helpful for them to be able to come in, condition their bodies, engage their brains, feel welcomed, be around people that understand. And it's a really great place for them to like exchange information too.
Well, we know Parkinson's, it can last for years. It's a chronic progressive disorder. However, it is managed a good bit with medications, but exercise and movement is such a key component.
Yeah.
So tell us some of the movement
Sure.
exercises and things that you do during that program.
Yeah, so the medication side of it's extremely important. That timed with a consistent exercise program is a really great way to help manage Parkinson's. The program that we do here, right now that we have going on, it's mostly seated and standing positional work. In general, the PWR program focuses on 4 key movements based off of functional activities of daily life type movement patterns. So the 4 moves are up, so anything working on extension, postural work, to build up the backside of people essentially. Rock, working on shifting weight. So even just things like walking, you're shifting weight without subconsciously knowing it. You've got a step move, which encompasses basically any type of multi-directional stepping, which basically just conditioning, strengthening the legs and hips. And then twist, rotational work. Everything that we do in real life, there's some degree of rotation. We don't always like turn and square up on whatever we're doing. So those are the movements, and we try and order that, like kind of lay them out in a way that one gets like an aerobic type effect for the greatest like neuro and muscular benefit.
Well, posture is so important in Parkinson's. The first move you mentioned, because they tend to get stooped and then they feel like they're falling forward. So it sounds like it's an excellent program addressing those 4 aspects.
And it's a great time. We do different kind of like brain games too to work on their cognition, things like that. Kind of, I guess I like to think I'm like their cheerleader, keeping them entertained.
Sure.
But there is a lot of like neural benefit of working their memory and giving them a motor task to do, as well as processing something, and helps them out. Like try and make it hard in here so that life out there is easy.
Well, I think the other key component is the social piece, as well as the fact it's a comfortable place to come. People are here and they all have the same condition and can exercise without any kind of feeling of stigma or whatnot. And of course, same for older adults. That can be a plus for older adults to come to a gym where they're around people their own age, with some of the same problems or issues, or just trying to stay healthy and moving. So it's just a wonderful asset to this community, I believe, this gym.
Yeah, it is great.
And thank you so much for being on the program and sharing your knowledge and showing us the equipment. And of course, we'll post those websites at the end of the program.
Sounds good.
On the MAC and the PWR.
Okay.
And again, I really appreciate your time.
Thank you, Mary.
And thank you for joining us for this edition of Focus on Health here on PAC 14. you.